C, D, E, F. A, C, D, F. CH2. Chemotherapeutic agents are drugs that are used only to treat cancers. B. Replace normal body chemicals that are missing because of disease. C. Interfere with foreign cell functioning, such as invading microorganisms or neoplasms. D. Stimulate the normal functioning of a cell.
Good morning, Densmax.
C.
Ayan, habang nagdadrop ay nakikinig
CH2. Receptor sites A are a normal part of enzyme substrates. B are protein areas on cell membranes that react with specific chemicals. C can usually be stimulated by many different chemicals. D are responsible for all drug effects in the body.
Good night na. Ayan, ang ganda ng sun. Iyan lang po ang dahilan bakit ako nag-live. Wala pong particular na reason. Kundi ang makita ko lang yung
CH2. When trying to determine why the desired therapeutic effect is not being seen with an oral drug, the nurse should consider A. The blood flow to muscle veins. B. Food altering the makeup of gastric juices. C. The weight of the patient. D. The temperature of the peripheral environment.
4, 3, 2, 1.
B.
Ako mag-red light.
CH2. Much of the biotransformation that occurs when a drug is taken occurs as part of A. The protein binding effect of the drug. B. The functioning of the renal system. C. The first pass effect through the liver. D. The distribution of the drug to the reactive tissues.
Yung aking
C.
recorder.
The half-life of a drug A is determined by a balance of all pharmacokinetic processes. B is a constant factor for all drugs taken by a patient. C is influenced by the fat distribution of the patient. D can be calculated with the use of a body surface nomogram.
Scores natin ay nakapasa tayo ng exams. Kaya, next is called term. Move forward na naman tayo.
B.
Ay, Lord. Another. Alam mo si Cindy ka
C,
talaga.
D, E.
Hello, Michael Official, MD. Marichu.
A, D, E,
Salamat po
F.
sa mga pa-BG ninyo. Ayan, makimarites tayo.
B, E, F.
Ayan po.
CH3. An example of a drug allergy is A. Dry mouth occurring with use of an antihistamine. B. Increased urination occurring with use of a thiazide. C. Breathing difficulty after an injection of penicillin. D. Urinary retention associated with atropine use.
Ito gusto ko tong group
C.
na ito. Atakin ko nga ito minsan pag mahuli ko kayo
CH3. A patient taking glaviritis is morning dose and then
Hindi ko kasi alam mga oras ng live.
several hours. An adverse effect that might be expected from this would be A teratogenic effect. B. A skin rash. C. An anticholinergic effect. D. Hypoglycemia.
Ng mga ilang araw kasi
D.
mag-aano na kami, magsasara na yung company.
B.
Ayan, nag-atake na yung mga
CH3. Patients receiving anti-neoplastic drugs that disrupt cell function often have adverse effects involving cells that turn over rapidly in the body. These cells include A. Ovarian cells. B. Liver cells. C. Cardiac cells. D. Bone marrow cells.
Ang work 7 o'clock pero andito pa ako kaya medyo
D.
nag-overspeed ako ng kunti pero okay lang naman ang speeding
B.
ko. Mga siguro 10 kilometro lang ang aking inad. Ayan.
C.
Salamat po sa mga attack ninyo. Hindi sana ako ma-atake sa puso, joke.
A. B.
Salamat po.
F.
Yan po yung yung YT attack na po na nakaka
A. B. C.
nakakataba
D.
ng
E.
puso.
F.
Ayan. Salamat ng marami, Sis Dance Max. Salamat po. Mga
A. B.
friends.
E.
Ayan.
F.
Hindi ko kayo ma-jacketan, pero tatay natin na magpa-jacket
B. C. D. E.
tayo nag-drive.
CH6.
Yung
Drugs
sun
can
ay
be
nasa
advertised
kabila.
in the mass media only if A. The FDA indication is clearly stated. B. The actual use is never stated. C. Adverse effects and precautions are stated if the use is stated. D. All adverse effects are clearly stated.
Ayan, nakikinig ako ng hello,
C.
Biotransformation. Ayan, pupunta muna ako ng trabaho.
CH6.
Pero
Herbal
nagagawa
treatments
na ako
and
ng
alternative
mga
therapies A
business,
are
no?
considered drugs and regulated by the FDA. B are considered dietary supplements and are not regulated by the FDA. C. Have no restrictions on claims and advertising. D. Contain no drugs, only natural substances.
kapag walang magyaya sa akin,
B.
maglakwat siya. Kasi nga, wala akong school ngayon.
CH6. Over-the-counter drugs are drugs that are A. Deemed to be safe when used as directed. B. Harmless to the public. C. Too old to be tested. D. Cheaper to use than prescription drugs.
Andyan na mga kaibigan, mamaya
A.
pag wala talagang magyaya sa akin na maglakwat siya, uupuan
C.
ko yung white tea. Salamat po ng marami. Ayan. Nakatulog na siguro
B.
si Kaislaw. Yan. Hinihintay ko si
C.
si Ka-Arnel kagabi na mag-message sa akin, pero nakatulog ako,
C.
kaya hindi ko
E.
na-check
F.
yung messenger ko. Ayan, medyo bilis-bilisan natin yung yung
B.
ating
D. E.
kasi nasa malayo pa talaga
C.
ako, hindi pa ako yan, baka pulis yung sa tabi.
CH53. Diffusion of CO2 from the tissues into the capillary blood A occurs if the tissue concentration of CO2 is greater than that in the blood. B decreases as blood acidity increases. C increases in the absence of carbonic anhydrase. D is accompanied by a decrease in plasma bicarbonate.
Mga YouTuber,
A.
sa lahat ng mga
CH53. The type 2 cells of the walls of the alveoli function to A. Replace mucus in the alveoli. B. Produce serotonin. C. Secrete surfactant. D. Protect lungs from bacterial invasion.
Ayan, the Bing
C.
Cubs channel.
CH53. A patient who coughs is experiencing a reflux caused by inflammation irritating the sinuses in the skull. B. Irritants affecting receptor sites in the nasal cavity. C. Pressure against the eustachian tube. D. Irritation to receptors in the trachea and conducting airways.
Ang dami ng mga sasakyan.
D.
Hindi ko na alam yung
CH53. Which of the following is most critical for respiration to occur? A. Low levels of oxygen. B. Low levels of CO2. C. Functioning inspiratory muscles. D. An actively functioning autonomic system.
Para
C.
tawag nito, may pagdating ng school ay
D.
hindi ako nahihiya ako pag wala akong masabi. Hello, Lynn.
B.
Ayan.
CH53. Which of the following would a nurse expect to assess if a patient has inflammation of the upper respiratory tract? Select all that apply. A. A runny nose. B. Laryngitis. C. Sneezing. D. Hypoxia. E. Rales. F. Wheezing.
Milestone.
A, B, C.
Ayan.
CH53. For gas exchange to occur in the lungs, oxygen must pass through which of the following? Select all that apply. A. The conducting airways. B. The alveolar epithelium. C. The pleural fluid. D. The interstitial alveolar wall. E. The capillary basement membrane. F. The interstitial space.
Marami sa inyong pag-atake dyan.
A, C, D, E, F.
Tumulong dyan sa aking live na
A, B, C, F.
Ayan.
CH54. A patient with sinus pressure and pain related to a seasonal rhinitis would benefit from taking A. An antitussive. B. An expectorant. C. A mucolytic. D. A decongestant.
Hindi na kami magkasama
D.
ngayon kasi from ngayon hanggang May 8
C.
wala kaming pasok. Ayan, nasa bahay sila.
CH54. Patients with seasonal rhinitis experience irritation and inflammation of the nasal passages and passages of the upper airways. Treatment for these patients might include A. Systemic corticosteroids. B. Mucolytic agents. C. An expectorant. D. Topical nasal steroids.
Ay, nako. Ayan po, 6:43
D.
ng umaga. Ang ating trabaho ay 7 o'clock.
B.
Ay. Mamaya sasabihin ko sa
CH54. Antihistamines should be used very cautiously in patients with A history of arrhythmias or prolonged QT intervals. B. COPD or bronchitis. C. Asthma or seasonal rhinitis. D. Angioedema or low blood pressure.
Kung sino man sa inyo dyan, ayan,
A.
alagad ni Papa Will.
CH54. A patient is not getting a response to the antihistamine that was prescribed. Appropriate action might include A. Switching to a decongestant. B. Stopping the drug and increasing fluids. C. Trying a different antihistamine. D. Switching to a corticosteroid.
Hindi na ako mag-BBS, diretso na lang ako sa unit.
C.
Bilisan mo naman, motor.
CH54, Dornis alpha, because of its mechanism of action, is reserved for use in A. Clearing secretions before diagnostic tests. B. Facilitating the removal of secretions post-operatively. C. Protecting the liver from acetaminophen toxicity. D. Relieving the buildup of secretions in cystic fibrosis. D. CH54. Common adverse effects associated with the use of topical nasal steroids would include which of the following? Select all that apply. A. Local burning and stinging. B. Dryness of the mucosa. C. Headache. D. Constipation and urinary retention. E. Fungal infections. F. Osteonecrosis. A, B, C, E. CH54, an antihistamine would be the drug of choice for treating which of the following? Select all that apply. A. Itchy eyes. B. Irritating cough.